Hello, my name is Dr. Tom Thomas. I am an emergency medicine physician by profession. I'm here to talk about the ongoing drug epidemic and drug overdose related deaths, especially today about the opioid crisis. The opium, morphine, was first extracted from the opium poppy plant, botanically called the Papaver somniferum. It was extracted by Dr. Sir Turner in 1803. The pain relieving property of morphine was known for hundreds and maybe even thousands of years. Doctors and profession use it effectively for pain management. Well and good. That is good. Human body scientists have found that we have a pain pathway and a pleasure, a reward pathway. Morphine work in both these pathways through its receptors called the opium receptors or the mu receptors. Through the pain pathway, you remember, or if you, I may show you a quick picture. The peripheral nociceptive pain receptors, when you get injured or hurt, the afferent fibers, nerve fibers, transmit that sensation, that message into the dorsal horn of the spinal cord and through the spinothalamic tract, through the thalamus of the brain into the cerebral cortex. All right. So it blocked that somewhere. It blocked that pain signals. So that's a good job. But the pleasure-giving pathway is the other major issue, and its withdrawal problem. The pleasure-giving pathway is it in the midbrain area. You remember the brain as the forebrain, which include the cerebral cortex and all those things, which different lobes, and the midbrain, a small area underneath the cortexes, and the hindbrain. In the midbrain, especially an area called ventral tegmental area, the mu receptors are plenty there. The opioid products, morphine and related synthetic, semi-synthetic products, codeine, hydrocodone, hydromorphone, oxycodone, now fentanyl, all these things, they attach to the mu receptors in the ventral tegmental area and produce a chemical called dopamine. At least it is believed like that. Science change, and it release the dopamine into the nucleus accumbens area, which give that pleasurable sensation. People like that in the human life, and there's a lot of stress and pressures, pain, sorrows. You know, they want to get out of that. Many people, or some people tell you, oh, you have pain issues or difficulties, try this tablet. They don't know what they are giving to you. You don't know. You take it. Oh, get my pain off, and then give that sense of well-being, and then you unfortunately and sadly getting used to it, and eventually culminate into the opioid use disorder. It starts with one use, and then maybe another use, and maybe a continuous use because the problem still persists. You like that euphoric feeling, and then eventually you spend money on it. If you don't have money, you borrow it. People don't give it to you anymore. You steal it. Legal problems, even go to the street to sell it. Females sell their body, prostitution. It powerful drugs that change your personality, make into a totally different person, coming into a stage that you don't care anymore. You seek for the drug, seek for the drug. That's why prevention is more important than cure. Okay. Fentanyl was discovered in 1960. Scientists were looking into the structures, chemical structure of morphine and related structures. So, opium didn't have to be cultivated, and fentanyl was discovered by Dr. Paul Janssen initially for anesthetic purposes to put people into sleep and major pain issues. As an emergency physician, I have used that fentanyl with midazolam or Versed, to induce some kind of a controlled situation, especially when you intubate a patient, along with other use of medications. You can use ketamine, propofol, etomidate, all those things. But Versed and fentanyl is used well. You can, in a controlled situation, intubate easily the patient in a rapid sequence induction type of techniques. But these money thirsty drug cartels know knew the way to make fentanyl, and they don't have to cultivate the opium anymore. They artificially and illicitly and make this drug. Even in unhygienic way, they don't care. Adulterated with powder, so many different materials, and flood it in the markets all over North America now. Fentanyl is killing people. So much death, so much death. So it is 50 to 100 times more potent than morphine. Okay, whatever be the situation in pressure, sorrow of life, drug is not the way to deal with that problem. You have to talk to your colleagues, a trusted person, a psychologist, professionals, doctors. You have to take charge of your control. Life is not without stress. So there are different healthy ways to deal with that. Please remember that. Talking to proper people and facing it with courage. All right. So the risk factors of using these drugs, family history of using it, peer pressure or curiosity, make you feel good about it, bullying, all those risk factors. Teenagers and adults get used to it and get into the problem. All right. Eventually you lose everything. It changes you. Family violence and theft and lying, and you don't report a job in time. You lose your job. You lose money. Oh boy, you become a destitute into the street. Lose your children, your family. Boy, you get guilty and despondent and use the drugs more and more to kill your pain. Overdose and death, suicide. This is the sad effect of that. So many thousands of teenagers, and they were all lost due to this problem. 1999 to 2020, the use of drugs and opioid related products 7 to 8 times more. 2019, 82,000 overdose death. This is American statistics. 2009, 20, 92,000. Out of it, 70 to 75% were opioid related deaths. The other stimulants and cocaine and all those things also cause death. MDMA, amphetamine, and all those things. 75% is opioid, and out of it now recently since 2017, fentanyl is killing people. It's 2 milligram is enough to kill a person. The market is flooded with the tainted laced products. You don't know what you are getting, and people take it, and it suppress your respiration, respiratory arrest, and death. Narcan is the immediate solution. Remember that, naloxone. So don't buy straight from the drug. Don't buy it from the internet. Absolute no. If you need it, you go and talk to the pharmacist or doctor, okay? And Tylenol or Advil under their advice. So people who are get into the problem, there is treatment. Immediately seek treatment. In Canada, Wellness Canada, and United States, there is agency called SAM HS, I think HSA. 1-800-662-4357. In Canada, 1-866-585-0445. Ask for help. Be bold. There's no stigma attached with it. We are trying to. I want to do myself whatever little I can with my motivational speak or public speaking humble ability I have. I want to use it with the help, with the collaboratively with the other people and agencies. So that's the most important things I have to say. All these negative issues, anxiety, depression, irritability, agitation, hyperactivity, paranoid, hallucination, family failure, violence, emotional memory, brain development. So I can take hundreds and thousands of more side effects of morphine. Why you use that? To get away from problems? Experimenting? No. Say no to drugs. It destroys you, changes you. You lose everything, become a nothing, and eventually depressed and commit suicide or drug-related overdose death. So watch out very carefully. If you like this video, pass it on to as many as people as possible. Pass it on, not for my benefits. God gave me a way of living. I hope to get back to my work. So pass it on. Call me if you need it. I will come and talk.